So we thought you find this phenomena of yin fire as a kind of pathological fire that begins in the lower part and burns up to the upper burner, and in that process tends to create a lot of agitation, anxiety, mental distress, and sleeplessness, these kinds of things. And the person with this condition often doesn't have a lot of yin deficiency in the sense of structural deterioration. They have kind of an edginess, an inability to relax, a discomfort, an inability to stop thinking. The yin isn't able to dampen out. So what is he thinking happens? The person has depleted their spleen qi somehow. That could happen through an emotional shock that disperses the qi. It could happen through bad diet. It could happen through overwork, general overthinking for a long time. Somehow the spleen qi has, even irregular lifestyle plays a big role here, because the spleen, to function well, demands regulation in life. Not just even eating at regular times, but doing, kids by nature are spleen not developed. We call it spleen deficient, but it's normal for kids because their spleen takes a long time to develop. And kids love regular, orderly routine. That's actually tonifying their spleen. If they don't get that, their spleen suffers as a result. So like an order, and you see, kids love repetitive stuff. They'll watch the same movie over and over again until they memorize the dialogue. It's driving you crazy as a parent. Not to hear that again, and yet it doesn't. The kids like it. So repetitive orderliness is a way of tonifying the spleen. If you live a chaotic lifestyle, which, by the way, we talk about post-traumatic stress, often precedes the post-traumatic stress. The person is thrown into a situation where they have a chaotic lifestyle. And so their spleen the spleen, when injured, doesn't produce the good qualities of blood and yin. As a result of that, various things are happening. Instead of yin being produced, blood and yin being produced, dampness is being produced. Think of our acupuncture here. We often talk about the partnership between the chongmai and the daimai. Right? The chongmai is the deepest root, penetrating through the center. The daimai is the surface, wrapping. And when the chongmai is empty of blood, the daimai is often full of dampness. That's this process going on. Dampness is accumulating while blood is being reduced. So now the mind is disturbed, bad dreams are occurring and stuff. Then as this dampness accumulates, it can actually be drafted upwards, because when the spleen is not transforming, when dampness is accumulating, stagnation is occurring, heat begins to rise. So this is why it's called yin fire. It's a kind of a yin deficiency from spleen qi deficiency that results in heat. And as I say, this person typically isn't structurally yin deficient. It's all on that more behavioral level. Edgy, sleepless, uncomfortable. Very typical in younger people to get this yin fire. Very characteristic of chronic fatigue patients. And so what Li Dongyuan says about this mechanism and treat it in total, if you just give this person spleen qi tonics alone, it's often insufficient. You should recognize that I need to also supplement some blood, some yin. I also should dry dampness. So he's saying you actually have to shoot a shotgun at this person. You can't shoot a very targeted thing. You have to kind of dress this in total. And I find this, those patients who seem to have this kind of yin fire presentation, it's true. When I treat them more generally, focusing on all of these different aspects, that's when it really engenders a change, rather than spleen qi tonics, moxa on stomach 36, moxa on bladder 20, or I need to do points that are going to get rid of damp. I need to relieve that liver's qi stagnation. I'm going to drain some heat down out of the heart. Do that sort of more complex interaction of points, herbs, whatever. Now, it does happen once in a while that tonifying spleen qi does work. For example, everybody knows the herb formula Buzhang Ichitang. And Buzhang Ichitang is usually said to be for central qi dropping. And it has, you know, herbs like chai hu and sheng mai in there that have a real lifting effect. It looks the herbs in it, and yet people who have yin fire, sometimes you give them Buzhang Ichitang. That was Li Dongyuan's formula, by the way. They actually become calm. They actually get, like chronic fatigue patients who get chronic low-grade fevers. Western guys call them fevers of unknown origin. They don't have an overt infection. Often you give them that kind of qi tonic formula. It's warm in nature, the fever stuff. Li Dongyuan's answer for that was, he mentions it when he talks about it, sometimes tonifying the spleen qi does pull down the yin fire that's rising. But in general, think of this as a more, you know, combined sort of disorder and approaches. So, can you talk a little more about post-traumatic stress? I said, yeah, I'll get to that. I just wanted to talk about this yin fire phenomena. I see this a lot. So what I do is I treat this complex as well as thinking about treating the brain. He didn't include that here, but I would add, do your points that fill the sea of marrow back up. Do 16, do 20, do 24, do a little moxon, do 20 if you want. You could add some Jing tonics that will help fill up the brain. Again, animal substances are particularly good for that. If the person's open to taking animal types of herbs, those things really nourish the brain a lot. Turtle shells. So, turtle soup would probably be good too if the person likes that. I don't know. Since we're on that page, we should also reinforce this. Yesterday I mentioned it, that Li Dongyuan, Zhu Danqi, famous doctors of those four classical schools, he talked about the 5 depressions or 5 stagnations. And these are the things that he said can easily accumulate in the body, with fire being accumulated fire from any of these others stagnating, and then fire builds up. Now we come to page 13. Here I want to these specific treatments for regulating the mind, specific acupuncture treatment. The first one is the treatment of the centers, as it's called. Do 20, kind of the center of the head, Ren 17, the center of the chest. So you see there's one for each of the 3 warmers anyway, Ren 17, Ren 12, Ren 6. Some say that it might be more technically correct to use Ren 7 there, because Ren 7 is considered the control point for the lower warmer. But I was taught to use Ren 6 here. And then the centers on the hands and feet, pericardium 8 and kidney 1. Some practitioners substitute pericardium 6, pericardium 8. But the purpose of this is to cause the Shen to reconnect with the physical body and circulate through the body. And so this is actually, treatment of the centers is to regather the Shen when it's been dispersed from the body. Some emotional circumstance, emotional trauma. So this is considered like one of those, we mentioned yesterday that the ling, the soul, has been dispersed out of the body. People will say, I've never been the same after that happened, after, you know, my loved one died, or after whatever. I've just never been the same after that. This is that sort of soul retrieval with acupuncture, is this treatment. The next one is the 4 gates and the 4 ports. This is for mental disorders where there's stagnation, particularly qi stagnation. So very good for depression or withdrawal. And the idea here is that you have the 4 gates that circulate qi when there's more excess stagnation, and then the 4 ports that are actually more tonifying in their circulation of qi. And so often we see that phenomena of liver qi stagnation due to qi deficiency. So this treatment kind of encompasses that because it has these qi tonic points that support the movement of qi. And then there's point in the center. This, my teacher said, this, may be just sort of a balancing thing, but it might also help relieve food retention or anything that's kind of obstructed in the middle of the body. This treatment is so famous, the 4 gates and 4 ports treatment. In Korea, there still exists the tradition of the mountain hermits. And these guys collect, the Koreans are wild about collecting wild foods. That's like a big activity. You visit with Korean families in Korea, and they're often the weekend activity, the sort of family outing, is to go collect wild foods. It's so strong there. I really enjoyed that, And you go out with them, you go out into the mountains, and you'll still meet these sort of mountain ascetics out there who collect a lot of herbs. And what they do is they come into the cities and sell the herbs in the cities. And they often just, on the street corner, they'll open these bags and they often dress, I think, more for effect than anything. They dress in the old traditional clothes, that funny little Korean hat that has that little brim, like that's too small for their head and stuff. They'll dress it. I think it's just, people want their herbs. But they often do street corner acupuncture at the same time. So people line up to get acupuncture from these guys because they're a mountain ascetic. They have lots of Qi cultivation is the idea. And what do they typically do? And they often take one needle, and they'll do large intestine 4 and liver 3, and then large intestine 10 and stomach 36. And they always do it diagonally. I don't know why. Some polarity in that. And so people just line up and get that same treatment. Every person gets that same treatment from this mountain ascetic. But it's specifically said to be a Shen regulating kind of treatment. Then the next one, the crying ghosts is the name of this. It's using well points. It clears the excess heat that harasses the mind. And so it's very useful for irritability, anger. People talk about vexation in the sense of helplessness, moving of the arms and legs, or something like that could be a physical sign of that vexation. And even in the case of withdrawal, where the person feels presents themselves as somewhat depressed, and yet their signs point to excess, like the pulse is fairly forceful, even though the person is emotive. This is said to then cause the Shen to come back out from that blockage. So it's using the well point. And the technical thing is just lung 11, spleen 1. In practice, practitioners will say, if those don't create a dramatic reaction in the patient, you can actually do more well points. So it's an idea of freeing the obstructive heat and phlegm and stuff by shocking it out with the well points. That's called the crying ghost. Then the 7 needles of the neck. This is similar to that notion of using window of the sky points and the like to reconnect head and body. The physical structure is such that we have this kind of a constrictive point at the neck, and the body has trouble sometimes maintaining balance between head and the rest of the body. And so treating around the neck helps to normalize. So this points out how the brain is so much part of this Shen. The person has too much yang stuck in their head, or they have dampness accumulated in their head. No matter which of these things, treating around the neck helps to regulate that. So this 7 needles of the neck are designed to balance between head and body. If you're too much in your head, you can use these points around the neck. Now, these are, a stated group of 7. In fact, we could use any other points around that region. Some practitioners prefer instead of having a set group of points, they palpate. Where does the person feel tight or sensitive? And not only on the neck itself, but also looking at the upper shoulders here, and also the jaw. You'll find that these points around the jaw are very susceptible to emotional constraint, right? Especially we have heat rising in the gallbladder meridian, heat rising in the stomach meridian. You start to get that grinding of teeth, the tension in the jaw. A lot of TMJ happens with those patients. Normally we say with TMJ, you have to treat these points on the neck, especially like gallbladder 20 and bladder 10, and then you come over and treat the jaw area itself. As a little aside for TMJ, if you make an insertion of your needle, go about a sun or so in front of stomach 7 and needle back like that into the joint, that really helps to get that little cartilage sliding properly. There's a little muscle there. It's a 1 sun in front of stomach 7. Oh, gallbladder 20 and bladder 10. But you, is it like the pterygoideus or something, that little muscle? Pterygoid, yeah, pterygoid. But anyway, there's that little muscle that's supposed to move a disc of cartilage forward and back in the jaw. And if that muscle is spasmed, which typically happens when this yang rises in the stomach and gallbladder, then you start to get all that clicking in the joint and all of that. So needling locally like that into that muscle helps to get that free movement again. You'll see even in like points and stuff, they use points around the chin and like that. It's the same idea. It's going to free that movement up. Oh, you know, I'll tell you, how about dyslexia as a learning disorder in kids? These points often are helpful for that too. I suspect in dyslexia, there must be an element of constraint of free chi movement because these points are so useful for dyslexia. Also with dyslexia, we treat the yin and yang chow mai. The yin and yang chow mai are involved with all kinds of crossover problems. Dyslexic kids often have trouble like doing cross-body stuff, like using their left hand at the same time or like that. And so problems of these kind of body crossover are a yin and yang chow mai symptom. You want to make sure to include that. And I like to use the confluent points, both sides of the body on these kids, and also bladder 2. Technically should be bladder 1 where they meet, but I don't needle bladder 1 on kids very often. It's not an easy, I don't think I've ever done it, you know? So, but that regulates that crossover. That Chinese medicine always concentrates on the yin and yang chow mai for crossover because those meridians are said to cross over as they enter the brain. The left side, yin and yang, to the right. That was how Chinese medicine explained the fact that trauma on one side of the head caused paralysis on the other side of the body. They had to figure out, had to come up with a theoretical explanation for that. That's why they drew this crossover of the yin and yang chow mai. So that's the 7 needles of the neck. Then we have this outer shu and shi cleft point targeting specific emotional factors associated with the various organs. In fact, for the yin points, the outer shu, for the yin organs, the outer shu points are named according to the part of the Shen that's there. The outer shu point of the lung is related to the po, and the outer look at their names, you'll see that indicated. And so when you have an emotional factor related to a specific organ, let's take liver as the example. If you have a patient with internalizing anger, holding a grudge, can't let go of things, do the outer shu point of the liver and the shi cleft point of the liver. If, on the other hand, you have a person who is externalizing anger and throwing things and breaking things, then you use the outer shu point of the gallbladder and the shi cleft point of the gallbladder, such like that. You can always target specific emotional factors by the outer shu point, shi cleft point. Don't you notice that people who have that kind of internalizing, people have externalizing anger, they're usually in a relationship with each other? What's up with that, you know? So the one person gets really mad, yells a lot, acts dramatic, and it's all gone. And the other, their partner is still mad. And they're like, but it's all over. And 3 days later, the partner is still mad, you know, and reminding them. And they're like, I can't even remember what I was fighting about, the person with the yang anger. Right? One person is a liver type, one person is a gallbladder type, you know, of anger presentation. Yesterday we mentioned already the 7 emotions treatment. This is the one when emotional shock has really depleted the body. People come in wailing and crying already before You know, they're already so emotionally distraught. I'm going to this treatment immediately. And of course, mind leaves chi. I always set people up. I am not against invoking the placebo effect as much as possible. That doesn't, for me, invalidate what I'm doing or mean that Chinese medicine isn't powerful. So I always tell the person, oh, I've got a special treatment here, the 7 emotion. It's just what you need right now. It's going to really make you feel calm and stronger. That leads their chi a little bit. You know, I set up the, why not? But it really, you know, I think physically it does it. Then we have the that go along with Shen Men. Heart 7, in theory, is the sedation point of the heart meridian. But the heart is protected. It's the emperor. And so it says in the Neijing something about this, that the heart meridian lacks the shu stream function or something. It means that point doesn't have an overly sedating quality on the chi of the heart. What it does is it calms the mind. Regulates, I would say, more regulates the mind. So we can partner heart 7 with other points according to the nature of how the Shen is disturbed. The most famous pairing always is heart 7, P6, but that is a very specific action. When you have yin deficiency disturbing the mind, and that's why that combination is so often indicated for insomnia. But really, you know, it's a specific kind of insomnia. It's when you have restless sleep or wake up a lot. That's what that combination is best for, because that's really yin deficient insomnia. If you have true heat insomnia, like you can't fall asleep at all, then you typically would pair heart 7 with pericardium 8. Really much more heat. I can see why people prefer to use heart 7, P6, because nobody likes to needle P8 that much. But it's actually better conceptually, since it's more. And after all, if you put strong pressure as you insert the needle at P8, it's not such a big deal. Same thing with kidney 1. I think people sometimes get a little overly dramatic about how. You know, I have a sort of philosophy about this in treatment, that patients often, it's like children. Children learn from their parents how much to react to stuff. Parents teach their kids to be so dramatic, you know? Like, I see kids get really exaggerated gag reflex when those parents who are so afraid their kids are going to choke to death. So the kid, you know, they're starting to wean the baby, and they put that pasty cereal in there, you know, made with wallpaper paper. So I think it's the same thing. You can buy it at Lowe's or you can buy it at the supermarket, right? You know, they put it, and the kid goes, and the parent is like hanging them upside down by their heels and banging on them, and no wonder that kid starts to choke on everything then. Right? It's a learned response. You see, if the kid falls down, they look back to their parents to see how much to react. You know, the parents are like, oh, honey, are you okay? Ah, they're crying. Like, I saw it the other, I was in the airport, and there was a family in front of me that was the mom, dad, grandmother, and little kid, looked to be about 2 or so, you know. And this little girl, she was walking in, and you could see she was excited. We get up to the security and all of that stuff, and she's looking around, not an apprehensive look on her face at all. And then her mom goes, now, honey, we're going to go through it. This man's going to look at you. It's going to be okay. You don't have to. And that little girl just went ballistic. You know, she started crying. She was so fearful. The mother clearly set her up for that reaction. You know, the little girl had no idea there was anything to didn't even think of being afraid. It's like this new, interesting experience until the mom was like, it's, you know, like, it's so interesting to watch how, and I think we do that as practitioners too. You know, I often, you know, start with a point that's not so sensitive. And then I'll just say to the person, oh, now this point's going to hurt a little more. I don't even get that out of my mouth before I already got the needle in. Into that, you know. I love to do bleeding. I find bleeding is so useful, and especially in these mental disorders with heat and stuff. And you know, a lot of practitioners these days are afraid of bleeding because of the blood transmission of disease and all this. And plus they think patients won't accept it. I never even tell them I'm doing bleeding. I do a few points. I said, no, I'm going to do it a point, and this one might bleed a little bit. Bang. I bleed gallbladder 1 a lot for eye disorders and stuff. Well, nobody's going to say yes if you ask them. But I'm needling. I'm like, okay, now I'm going to do a point here. This one might bleed us, but, you know. They're like, oh, that did hurt. Yeah, if it's all over now. Blood's coming out. And then they say, oh, my eye feels like conjunctivitis. Oh, my eye feels so much, you know. I bleed old people a lot because they have all blood stagnation. People get so afraid. Oh, don't you afraid of making them deficient? Not at all. Because the blood stagnation is there. You've got to get that moving. So you get all the orthopedic problems in old people. Bleed the heck out of those things. They get the chronic knee problem, prick points around there, the back pain, you know, all the discs are thinned out and stuff. Of course, systemically, I'm tonifying kidney in. But locally, I'm bleeding. Cups on there, blood's coming out. So, again, if I'm walking in, you know, putting a face shield on and pulling on the rubber gloves and all that, now I'm going to do bleeding therapy on you. Oh, forget it. You know, that's already, like you can see the blood draining out of their head, just anticipation, right? We were joking yesterday about people passing a lady with exactly this problem. Maybe she was in her 80s, you know, and she had really thin disc and was having spinal stenosis as well, was having a lot of low back pain. The very fact that she's having a lot of pain tells you there's some local excess, doesn't it? You know? And so I had her lay down, prick points on her back, put the cups on, and of course the cups really encourage the bleeding. And so she's laying there, and we're talking, she's fine, and her son, who had driven her to the clinic, I don't know, in his 50s, you know, he walks into the treatment room, saw that, and passed out. And she's laying there, she's like looking, what happened? What's wrong with him? She's the one bleeding, you know, old, no problem. He just, the sight of it, you know, he just dropped. The sight of blood was enough. Anyway, back to our list here. So we have pericardium 8, draining heat. Don't shy away from that, it's no big deal. Pericardium 5 clears phlegm in the mind. So when you have disturbed thinking, unclear thinking, then you want to pair heart 7 with P5. Heart 3 builds heart blood, helps anxiety, really helps dream-disturbed sleep and such as that, or non-restorative sleep, as we talked about. It gets the Shen to relax more. It can be comfortable in that blood nourishing the Shen. For stagnation-type problems disturbing the mind, heart 7 with liver 3. And then for often what they say sort of weak mind, where you kids with learning disorders again, where you feel like you can't concentrate, you're not alert. Also postural hypotension, where you stand up and get dizzy, helps to add heart 6 and 7. And I do this with one needle, just with oblique insertion. Heart 6 really raises the heart chi. Some practitioners like to use heart 9 as well. Heart 9 is the one, not the only, in fact, but is one of the well points that can have a definite tonifying function on its organ. So heart 9 can boost the heart chi. I could think sometimes moxa for lifting the central chi, we moxa to stop bleeding, we moxa for anxiety. So that's another well point we sometimes tonify. And liver 1, we mentioned yesterday, for overly shy, lack of self-confidence and stuff, we raise liver yang with liver 1 and often moxa that. Of course, moxa on liver 1 and spleen 1 are good for hernias. Lift the central chi, move the cold stagnation in the meridians it causes. So those are sometimes used for tonification. Next comes the famous 13 ghost points. These points regulate the Shen. And there's a big debate amongst scholars who, I mentioned I've been doing this program in China over the last few years on classical studies. And it's been, I guess, 4 years ago now, maybe our particular study was on Qianjin Yaofeng, the Sun Simi Yao's text, where he talks about the 13 ghost points. And so the various scholars who were presenting, they're these guys that they're not practitioners of Chinese medicine at all. They love to get in the textbooks and, look at the contemporary, authors that were contemporary to whatever classic and see, and they debate whether he meant the 13 ghost points to be a fixed set or they were just some suggestions of points that regulate the mind. They also debate what he meant when he said there's a common view, in fact, that his intention really wasn't to say these are exorcistic in that they take some kind of entity out of the person. They're actually, because he in another writing, he makes a comment that you should relate to the person in terms of their belief structure. And he says, if a person believes they have an entity, you shouldn't try to talk them out of them. You should regulate their Shen. They will naturally drop that notion. He goes on to say that if the person's a Buddhist, you should tell them that the treatment clears their bad karma. And if they're a Taoist, you should tell them the treatment puts them in harmony with the Tao. His approach seems, he's often said, Sun Miao is often said to be the first practitioner that emphasized treating the patient in accordance with their belief structure, rather than superimposing your belief as a practitioner on the person. That's why we mentioned yesterday that romantic love is a Shen disturbance. It makes you act. Sun Miao spoke out against that. He said, no, romantic love is a quality of the Shen. It's okay. Now, he had lots of weird ideas. He's actually said that he dressed in women's clothes to make the press patients laugh, which was a big deal for a high-level...
Chinese Milton Berle.
Yeah, he sort of had... I mean, of course, he was also that guy we mentioned yesterday that said you should have 10 sexual partners to cultivate your longevity. You know, he had lots of curious ideas. But we have inherited from him this notion of the 13 ghost points, and some practitioners do this in a very rigid way. They do the points in a definite order. They try to do all of them. Some of the points he suggests that you should actually warm the needle before you put them in place. But if we look at it, we see that they're the typical points that we would think of for Shen disturbance. They do have some points around the jaw, stomach 6 is in there, Ren 24 is in there, some points that sort of connect head and body in that way. And so there's also points that, again, some practitioners think they're in there because they're just points like Ren 1. Is that really so essential for mental disturbance, or is it in there because it really invokes in the person this drama of something is you're treating a very private area of the person's. Now, it is true that do 1, as we'll see here in the next one, is so important. For depression, withdrawal, low affect of any cause, we can invoke treatment number 9, which is to raise the yang in the dumai. This makes the person's Shen come back out. So if the person is taciturn, momo, like if the person is stressed, and you want to help that, you want to lift their affect, you want to try to, they're plagued by sadness, you want to raise that level back out, you should use raising the yang in the dumai. The oldest mention of this is to just stimulate strongly do 1. Propagate qi up from do 1. Then this treatment got more developed, and as my old mentor used to say, really what you do to invoke this treatment is you do a series of points on the dumai, starting at the bottom, going up, and just do whatever points you remember. Because he said the point here is not specific. The points are conducting qi along the dumai. And in the process, that yang stimulus carries the Shen, brings the withdrawal back out. So he would say, you don't need do 1. You could start at do 3 and do 4, do 6, do 9, do 12. The big points you use all the time. You say do 7. Oh, I never use that. I hardly remember which one. Is that under... No, skip that. Go on to, I use do 9 all the time. Okay, and so you're just doing a series of points up the dumai, all the way up to do 20. So personally, I tend to use, let's say, do 3, do 4, do 6, do 9, do 12. Use do 12 is so important. Body at that point, and it really is so much for strengthening that qi movement along the spine. Do 12, special point of tonification in infants. For that reason. Infants are trying to become upright. They haven't yet been able to, so babies, you put a baby on its tummy, it always does cobra, like, like that, And when it does that, there's a depression between the shoulder blades. You put moxa right there. That's said to be moxa do 12, the body pillar. You don't even count the vertebrae. You just, that deep spot there, you put moxa. That helps kids develop stronger, and they'll have a straighter spine and so forth. So anyway, I always include that in this raising the yang. Like do 16 and do 20. And I then come back with a moxa stick and start at the bottom and work my way up with heat. And we'll get such an emotional lift out of that. Again, set it up for them a little bit. Tell them, I'm going to do the special treatment for depression that really will make you feel much more outgoing and happier. And you do that, and they'll come back asking for it. Oh yeah, I really felt that you were right. You do a leading suggestion always helps, doesn't it? I'm going to put this needle, I'm going to put that needle, you're going to feel this, you're going to feel this next one, and now the energy's going to come, and you're going to feel much more outgoing, and that really, that really. I'd say acupuncture is a way to implant suggestion into the person. Here we already mentioned the window of the sky points, and finally, points around the holes in the head, the eyes, the mouth, the ears. The sense openings have a direct connection to the Shen. It's exchanged through the openings, perceiving the outside world and stuff, and then our Shen shines out through our eyes and all that they say. So, especially the eye. Eye disorders often have a strong emotional connection. Treatment around the eye often produces strong emotional release. We can look at classical discussions of eye disorders in Chinese medicine, and they say many cute things, like how as you get older, you become farsighted because your Shen has gained wisdom, and you're not so concerned anymore with the local things close to you. You're looking off at the big picture. It's cute, right? But on the other hand, kids often get really nearsighted from stress and so forth. And often you treat around the eye and the person has, and it freaks some practitioners out because, it's a little delicate doing points around the eye. And so you're doing bladder 1 or you're doing this Chu Ho point, and the person suddenly starts wailing, oh my God, did I hurt their eye? In fact, what you did is provoke a big emotional release. We see a lot of eyes, glaucoma, for example. A lot of glaucoma is constrained emotion. And so you release that constrained liver qi and take down the liver heat, and the glaucoma really is responsive. So think of that. We'll look at eye disorders in strabismus, paralysis or lack of movement in one of the external muscles in the eye that's not aiming. Often emotional release helps that a lot. And so when you do your treatments that regulate the Shen and do your local treatment around the eye, you're actually doing both things. You're treating the local eye disorder, but you're also treating the side of it. I'm a big advocate in eye disorders as well. Make sure you don't get overly shy in needling. Since they have all this activity around the eye, I especially like the 2 points I mentioned, bladder 1 and Chu Ho. Those have a very strong regulating effect on the eye in general. We'll talk about eye disorders a little bit. Okay, so we should take a break.